Hi, good afternoon. This is your County Executive Ed Day, and I want to thank you for joining me today. We have some amazing, exciting news for all of you. Most of you, I'm sure, have heard that. But yesterday morning, Pfizer announced their vaccine was found to be more than 90% effective in preventing COVID-19 in the first analysis from their phase 3 study. To put this in perspective, the notice that we got here, Dr. Fauci himself looked at that 90% figure and said it's just extraordinary. You may have noticed that some of the conversations about the original vaccine will put the numbers of efficacy at 40%, 35%, 45%, but 90% is a phenomenal number. I will give you a comparison. The immunization for measles is a 97% efficacy rate. So this is really amazing. This study enrolled 43,538 participants, with 42% having diverse backgrounds. No serious safety concerns that have been observed at all. However, they continue to collect additional educational and safety efficacy data. If these preliminary results hold up, they plan to submit for emergency use authorization to the United States Food and Drug Administration in the third week of November. That is not far away. Along with the efficacy data generated from the clinical trial, Pfizer is working to prepare the necessary safety and manufacturing data to submit to the FDA to demonstrate the safety and quality of this vaccine. Based on current projections, they are expected to produce globally up to 50 million vaccine doses in 2020, this year, and up to 1.3 billion doses for next year in 2021. Pfizer plans to submit data from full phase 3 trial for scientific peer-reviewed publications. And Pfizer Chairman and CEO Dr. Albert Bourla said yesterday, I want to quote him so you can get it exact here, "We are a significant step closer to providing people around the world with a much-needed breakthrough to help bring an end to this global health crisis. We look forward to sharing additional efficacy and safety data generated from thousands of participants in the coming weeks." On a personal note, I should be saying this on behalf of all of us here in Rockland County. We all should want to thank the thousands of people who volunteered to participate in these studies. I would like to join him in thanking those volunteers while also mentioning that Pfizer's Pearl River site, yes, Pearl River, local, Rockland County, is primary research and development center for developing this vaccine aimed at preventing COVID-19 infections. My thanks and congratulations to the hard-working team in Pearl River. It's difficult to describe how great it felt to hear this news as the county executive, to hear your county being front and center of something that could potentially save this planet. It's really amazing when you think about it. But Pfizer is adding to a proud 113-year-old history where the site had produced treatments for diphtheria, for leukemia, and developed vaccines for smallpox and polio. You are making Rockland very, very proud, and I want to thank all of you. And to everyone else here, I think we can all agree that we have some very special people among us, which makes this place called Rockland a very special place. So with this, I'm going to turn this over to my Director of Communications, John Lyon, who's been fielding some of your questions today. John?
Okay, thank you. First, couldn't agree more with your congratulations and thanks to everyone working in Pearl River. It makes me proud to be a part of this here in Rockland. So thank you to everyone who wrote in with your questions today. First things first, how are our numbers looking locally?
Okay. At the end of the day yesterday, November 9th, we had 992 active cases. Now, that's down from a high of 1,649 cases back in early October. That is about a 40% cut. I also want people to know, because I know a lot of people do track these numbers. The state of New York on our control room call today made it very clear that they are a bit overwhelmed with the different things they're trying to track. So some of these numbers are being delayed a bit. They may be delayed from one day to the other, maybe a matter of a few hours. So those who have been used to seeing the numbers at a certain time of day, you may not see them at exactly the same time. And the state's been very clear that the one simple reason is they are looking at tracking so many different lines of data right now to try to identify any hot spots that need to be dealt with. The number that we're looking at has been fairly steady for the last 3 weeks, hovering between about 900 to 1,000 cases. Most importantly, in many ways, and again, this is a whole different ballgame from what we saw back in March and April and May in the spring. We currently have about 24 people hospitalized and confirmed to have COVID-19, and that number has been fairly steady for the last month. One thing to keep in mind is that while hospitalizations, while certainly are concerning to the patients involved, are manageable. There are roughly 36% open capacity for hospital beds and nearly 60% open capacity for ICU beds. So again, we right now where we have evolved to, we look at some of the key data that we look at is going to be hospitalizations now. It tells us the seriousness of the disease, and at that measure, which many people are coming to coalesce around, we're seeing some stability, which is great. But what we need to do is very simple. We need to continue to take common sense precautions to keep the disease in check. Social distancing, wearing a face covering if you're medically able to do so, wash your hands, and stay home if you're sick. By keeping up these hygienic practices, we can continue to manage the disease as the weather turns cooler and people spend more time inside. Another thing people are looking at right now, and it seems to be bearing out, that once the cooler weather is coming, people spend more time inside. They're more in close proximity with others. Some have said that there seems to be indications that those who end up getting this virus are those who may have been repeatedly exposed, not in just a passing manner. But at the end of the day, we all can commit to this. It's all common sense. Things that we were taught as kids, things we taught our kids when we were young parents. Stay out of people's faces. Don't touch your mouth, especially your eyes, with your hands. Keep your hands clean. If you're sick, take care of yourself. These are all very basically common sense things. And if we stick with that, we're going to be good.
And one thing to add on there that I've seen several times now is I've seen people who are coughing or sneezing who don't want to necessarily sneeze into the mask. They're actually taking the mask down, which is not the correct thing to do. That's the purpose of the mask, to keep those germs from spreading. So please keep that mask on, particularly if you do think you're sick. Stay home if at all possible. That's what's going to get us through this.
I think they're afraid of what they'll look like if they sneeze into the mask.
Exactly. So, but moving on to our next question, when are movie theaters opening here in Rockland?
We have been advocating for this. Again, I'm going to go into what is being expected in other areas of the state for movie houses that are open right now. No new ground has been broken as far as the planning and exactly what's expected. But the governor announced in late October that in order to open movie theaters, counties must have a positivity rate of below 2% on a 14-day average and have no cluster zones. Obviously, we have a cluster zone here in Rockland County. We have an orange zone with a yellow buffer zone in Ramapo. While we received good news in seeing our red zone decrease to that orange zone last week, we have further to go to meet these standards. Unfortunately, I cannot share a possible date with anyone at this time, but movie theaters are open in other parts of the state at 25% capacity with a maximum of 50 people per screen. Masks are also required while assigned seating to ensure social distancing. And we hope to have some better news for the movie houses. We're working on movie houses, working on billiard halls. There are a number of different industries. We've gotten requests from some schools. We've gotten requests from some businesses for clarification purposes. So if it's appropriate, we're advocating for the business or industry that is trying to open up.
Absolutely. This next question is a two-part question. What COVID numbers would it take for Rockland to, quote, close the valve a bit, as Governor Cuomo says, and roll back some of the opening? Additionally, there have been discussions with the governor on curfews, or have there been discussions with the governor on curfews as is being done elsewhere? Well,
you've heard us speak about closing the valve down. This is something that the governor spoke about very early on. He opened the valve under phase 1, 2, 3, and 4, and should there be any burps in the plans, he would start closing the valve down. For all practical purposes, that happened in Rockland already, except it wasn't the valve, it was a red zone. What that red zone did was shut down non-essential business and create a number of other limitations. So for all intents and purposes, that's what you saw here already. The positive thing is that the focus now seems to be on hotspots, not an overall shutdown of businesses. But at the end of the day, our numbers have been trending in the right direction, number one. We do not believe that a closing of the valve is going to be necessary countywide in any way at all. But I'll be very frank with you, the effectiveness of another shutdown is highly questionable in my view. If we're going to do anything, it has to be following the science. It's been said many, many times. One of the things we spoke about very early on with the red zones, and I've heard from many of you, if you have a red zone, obviously they're basing the locations on residences for all practical purposes as to where the infections are. So when you make a red zone, what the one critical piece that's missing is an effort to try to ensure that people stay within that zone and not travel elsewhere. So it would seem to me that if we're going to have any more zones created in it that's defined by the residences of people in a certain area, it has to come with a request at the very least, or an urging at the very least by the governor that says basically to people who live there, look, the exposure period or the incubation period is a couple of weeks. As part of this process, we're going to really request that you stay in the neighborhood, and this will give it a chance to everything to calm down and not let the spread get outside of those red zones. But again, right now, we don't see any need for that. I do implore residents to keep doing the right thing and help us keep the numbers low. There have not been any discussions with the governor's office, nor has it been raised as it relates to a curfew here in Rockland County, and I'll take it one step further. In the mid-Hudson, in the lower Hudson Valley region, mid-Hudson region, we have not heard anybody mention that to us for all 7 counties that are part of that region. I do have a couple extra things. I saw we were a little light on information today, so I added some items. Okay, I picked 3 items that I hope that I will touch the hearts of a few of you, and maybe a little more than that. But first of all, this coming Sunday, November 15th, 10 a.m. to 1 p.m. at the Robert Yeager Health Complex off Route 45 in Pomona at Building F. There's going to be a drive-through rabies clinic for cats, dogs, and ferrets. So that's Sunday at November 15th, this coming Sunday between 10 and 1 p.m. John will put this in the comments section, so you'll have a link or additional information.
Yep.
And this is on our Facebook page too, I believe, John, our Rockland County page.
Yep.
So if you go to Rockland County Government on Facebook, you will see the same things I'm telling you right now. I'm just trying to focus a bit on them now, so we have a little time. Yes, John?
One caveat to the rabies clinic. Please check our Facebook page Sunday morning. Right now there's a concern there could be heavy rain,
right.
Which doing a drive-through event with taking cats and dogs out of cars to give them shots is not really feasible in a downpour. So if the forecast is going to be, really wet, really
right.
heavy rain, we will likely be canceling that event,
right.
but we will put that information on our Facebook page Sunday morning.
Now, this was scheduled earlier, wasn't it? And then it was delayed because of a rain event.
Yes.
Okay, so basically the message we're leaving you with, if it's raining cats and dogs, we're not going to do it. I hope we'll get a couple of laughs out of that. Anyway. Okay, one more thing. We used to do this without the technology tools at one time. When I was a legislator, we used to set these programs up in various places. We did one at the New City Jewish Center, for example. A 2021 Medicare update teleconference. This is sponsored by the Rockland County Office of the Aging and the New York State Statewide Senior Action Council. So this is something that would be very, very helpful to folks who are on Medicare. It is a very difficult process to navigate sometimes, so it's not there to give you information and get you going on that. This is Tuesday, it's a week from today, Tuesday, November 17th at 11 a.m. So John's going to put this up also. You can also call our Office of the Aging at 845-364-2100. Again, 364-2100 if you want to get information directly. They'll provide you for the link to get to the meeting. And again, this is great information to have, and it gives you a chance to get up to speed on any changes in Medicare that may be affecting you. It's better to find out early rather than after the fact. We all know that. Finally, I'm going to try to maybe reach down and do something to help your palate by tapping into culinary delights. We have the annual Hudson Valley Restaurant Week, and it's actually almost 2 weeks. It started yesterday, November 9th. It's going through November 22nd. It's an opportunity to try a new restaurant that maybe you haven't tried. Some of these restaurants are a little on the higher end for cost. That there may be a 3 or 4 star restaurant instead of 2 or 3. So, you maybe you haven't gone there yet because it's a little tough in the pocketbook once in a while. You could go there, or you can check and see if your favorite restaurant is one of the ones that will be part of Hudson Valley Restaurant Week. So it's a great opportunity. You can enjoy a 3-course lunch for $25.95. You can enjoy a 3-course dinner for $35.95. Now, I'm going to be very honest with you, this is a little bit more than it has been in the past. It's actually $3 more per meal. And the idea here is to put aside some money for these restaurants that have been taking a beating during the COVID crisis. So it's a $3 added charge to the meal. For those businesses, those restaurants who've been trying to make a go of it during very difficult times. And if you're going to go there and get a significantly reduced cost meal, it's not going to hurt to help these folks out. Many of us have made a habit of going out to do a lot of takeout and patronize them in that manner when they were closed. And again, like I've said before, never forget that these are our neighbors, number one. These are many of the same businesses that afford the opportunity for our local volunteer fire and EMS personnel to go to a call of service, which may affect you or your family in particular. They also the ones that if you are looking to have your child's sports team sponsored, oftentimes these are the organizations that will put up the money for a sponsorship, for uniforms and the like. So, and also if you have a special cause dear to your heart, many times these restaurants and these local businesses will contribute money to a cause that's important to you. So this is paying it forward, I think, at this point in time. So whatever we can do to help each other, I think is critically important. I think if you just look back to the very beginning of this program, where we spoke about those 40,000+ volunteers who basically gave their bodies up to science in service to all of us. I mean, it's pretty amazing you think about it. And I said we have very special people around us. And again, I want to finally just give another shout out to the team over at Pfizer in Pearl River for all their work. And it's a great thing to see the Rockland County being front and center. We were there once before with the measles epidemic. We were looked at as the lead county in the nation, and we got inquiries from foreign countries, on how we conducted ourselves, how we beat the measles outbreak, and we're very, very proud of that. So it's a good way for Rockland to be in the map. So with that, I'm going to call it a day, and we'll be catching up to you sometime soon. I don't know what day we'll be doing this next week, but we'll put it on Facebook and give you a heads up on that. So in the meantime, this is the County Executive Ed Day signing off. Have a wonderful afternoon and evening.